ethical issues in obstetrics and gynecology. And this mainly depends on the ethics of the practitioner and the law of practice. Our objectives by the end of this session is to conduct informed consent, maintain confidentiality, describe issues of justice relating of obstetrics and gynecology care, apply a systematic approach to ethical problems based on ethical principles and integrate with the medical decision, discuss ethical dilemmas in obstetrics and gynecology, and this will be always a place of discussion because cases and situation will be evolving as long as humanity is there. But let us go first to the principles of ethics. I think you've taken the informed consent and ethics of practice several times in our curriculum. So this is just a review. So we have the 4 main pillars of Hippocrates, which is autonomy, beneficence, non-maleficence, and justice. Each one of those terms has a very deep meaning that we should always understand. And whenever we are practicing, we have to ensure that we are practicing based on those 4 main pillars. They are the pillars that guide the facts and that drive the desired service to be how it is given. It gives the shape and specifications. So whenever you are doing something and it doesn't goes with those, then think that we might be doing something wrong. So what is the informed consent in Arabic? Does anyone know? Please feel free to participate. What is informed consent and why did they not say consent? Anyone can answer. Otherwise, I will be choosing from the audience.
يعني دكتور السبب.
No, what is the meaning in Arabic? Informed consent. If you don't understand the meaning and you don't know the definition, then you will not be able to you cannot practice something that you don't understand. أنا الكلام مش ليكي، أنا أتكلم in general. So what is informed consent? We have to know. We are going now to a serious period of our life where you will be practicing medicine. You're not anymore an undergrad student. You're a sub-intern. So you will be handling patients and delivering medical care. So what is informed consent? Anyone else?
الموافقة المستنيرة.
نعم، الموافقة المستنيرة. إيش يعني الموافقة المستنيرة؟ في كلمات بسيطة ممكن نشرحها. إيش هي الاستنارة؟
يكون الشخص على علم بكل شيء موجود.
نعم، يعني موافقة مع علم. ممتاز. إذن العلم بكل شيء. العلم بالخيارات، العلم بالنتائج، العلم بالمخاطرة، العلم بالقدرة على اتخاذ القرار. لازم أنا أكون متخذ قرار. إذا كنت مغصوب هذا ما هو إقرار بالعلم. هذا ما صار، هذا صار إذعان. وعشان كده في حتى في العقود وفي في عقود يسموها عقود إذعان، هذه ما تنطبق عليها العقود العقدية لأن أنت مدت خيار. الموافقة المستنيرة جدا مفهوم مهم، ولما أنا أجي أشرح للمريض أو أعطيه القدرة على اتخاذ قرار لازم تكون في حدود الموافقة المستنيرة، وهذا اللي هنتكلم عليه. ممتاز. So لما نرجع للمبادئ الأربعة or when we go back to our four which is الاستقلالية، الإحسان، غير مؤذي، والعدالة. So we have to go and look at some cases. Let us discuss one case and then we will discuss one of the those four pillars or concepts. A competent 30-year-old lady, she's 38 weeks pregnant, refuses to have a cesarean delivery despite the fact that without surgery, the fetus could die. Both her surgeon and psychiatrist have failed to convince her to have the surgery. What is the most appropriate action for her surgeon to take at this time? So this is a real life scenario that you might face in obstetrics and gynecology. You have the mother, you have the father or the partner, and you have the doctor, and you have the baby. And now there is a risk based on our best knowledge that this baby could die during this delivery and she needs a surgery. What should be the action? Yeah, anyone?
نوقعها على ورقة إنه لو صار شيء هي تتحمل المسؤولية.
ممتاز. احنا راح نوقعها اول شيء عشان نوضح ونحميها، لكن في شيء ثاني؟ Let's look at the case. مين الآن اللي هيكون متضرر؟ Who will be the affected? Who will die?
The fetus.
The fetus, good. So who will protect the fetus? The doctor, the husband, the mother, the psychiatrist, the law?
The surgeon.
The surgeon. So I will take the decision and I will go take her to a cesarean section, even if she's refusing.
Yeah, I think.
Okay. Any other opinion? So Ragad is saying that we will have a cesarean section to save the baby as no one is there to protect him. And this is our responsibility. He's in our facility and we have protected him. Okay. Any other opinion? هاخدكم بالدور. يلا ساري. You have to participate. Yes. So what do you think? طيب اللي بعده.
The doctor has to give the advantages.
So you have to give her the advantage and the disadvantages and
Yes.
explain it fully for her. And then we will do, as your friend said, we'll let her sign a paper or disclaimer or refusal, right?
Yes, doctor.
طيب, anything else? Anyone want to add? Another opinion? So واحد هياخدها، واحد هيوقعها، وواحد هيشرح لها. طيب ولسه ما انحلت المشكلة، هل انحلت المشكلة؟ هل في أطراف ثانية لسه ما تكلمنا معاها؟ وهل لهم دخل أو ما لهم دخل؟ إيه the husband.
The first degree relatives.
Okay, so the husband دحين صح؟ So husband convinced and he agreed. The mother still doesn't agree. What will happen now? يلا وهج. So this is the dilemma. طيب أنا ما باخذ الوقت لأن الوقت قصير أصلا في رمضان هي 35 دقيقة. So this is a real dilemma and whatever is doing here we did not solve. طبعا الأصل إنه الموافقة هي حق الأم لأنه هذا جسم الأم. طالما الطفل or the baby, the fetus still within the mother, then still it is her choice. طيب, is this patient is competent? She have a psychiatrist. We have to look because maybe she's not competent. So we have to assess her competency and ability to take decision. Okay? We're going back to autonomy. هو القدرة على اتخاذ القرار والاستقلالية. الواحد اللي فاقد عقله فاقد الأهلية. فهذا واحد من الأشياء. الشيء الآخر, husband doesn't have the role to agree or not agree. صح هو husband, but the fetus is under mom. And the Saudi Arabia, MOH, before they used to have the consent of the mother and the father for any procedure for the female. Now the female is fully independent. She can take her own decision. She's empowered. So this we can talk. We should talk to them because he's the husband and that, but he doesn't. We don't need his consent. Anyhow, as I mentioned, I have to explain. We have to write the paper, but we have to give her the consequences, and protect ourselves and the team. But we have to work on convincing her. We don't have the right to take her to OR. We will provide her with the best service based on her decision. We should not pursue her based on our only opinion or what we see. We have to explain to her. Okay, next case. So this is a dilemma. I know it's shocking, but it is a dilemma that happens weekly. Right. So what is an informed consent? Confirmed consent is a consent obtained freely, so there is a free will, without threats or improper inducements, after appropriate disclosure to the patient of adequate and understandable information in a form and language understood by the patient. On. Yeah, we have to explain it, and you have to explain it in simple words that match the patient language and ability to understand. You cannot give terminologies for a patient in the clinic who is not from the background. You should give it in the simple language. You cannot, and you give them that they don't take the language or talk the language. You have somebody from another nationality. They don't talk in Arabic or English, but a little bit of that. And then you explain to them a procedure. He will not be able to understand and comprehend the whole idea of the surgery, the alternative. There will be some limitation. So this is not appropriate, and you will find it sometimes in the hospitals, or you bring a translator who is not of medical background. You have sometimes we get the workers in the hospital. They need a surgery. They don't speak Arabic. A little bit of Arabic, a little bit of English. والله أعلم فين تعلموه. And then you bring another one who has a little bit better understanding of Arabic and English, but he's not professional in the language. And then he will be explaining. You're explaining to the patient through that person. It happens, and it happened many times, and it's wrong, because you cannot deliver the whole situation. Sometimes these are major decisions in the life. So the patient should be informed about the expectation of benefits, other reasonable alternative, possible risks that are known, and this will include risks, complications, expenses, future fertility, future abilities. This should be all informed, and they should be in the form that they will take decision. You cannot ask them to put them in a situation where they don't have another option. في العيادة كنا نسوي ونغلط. I don't want you to do the same mistake. We grow up and we change. يا أختي إحنا في عيادة حكومية، عندي سرد طويل، تفضلا تاخذي قرارك ولا شوف لك دكتور ثاني، أو إنه خلاص هقفل ملفك. الغرض ما كان إهانة ولا كان. It was not for to demolish the patient right. It was, at that time, we thought we are doing good for the system. We want to see, we have 30, 40 patients sometimes in one clinic. I want to finish them up. When I grow up and we mature, this is not an ethical practice. You have to give the time. Nobody can take decision of surgery in one clinic or one place and alone sometimes. You need to think. You need to really, you give time. You cannot give him 5-10 minutes to explain a surgery or a decision. So this is, I'm giving you what we have done wrong and how we look at it now as we mature. So the patient should be competent. He should have the capacity to make a decision free of a defect of mind or judgment, or not to be a minor. Sometimes the minor, and you have to look where you are practicing. Definition of minors and who can legally take decision is different from puberty. You have to always look at the law, and we have here the Saudi Commission for Health Sciences. They have their ethical conduct and what is expected from the health practitioner. We have the MOH, we have the Saudi Health Council. We have many councils, we have regulators, we have the law. So you need to be, wherever you will be practicing, aware about all this. And we have, of course, a Sharia and your ethics. You will be moving to non-Muslim countries. They have different laws. How you will be practicing your religion, and you're practicing medicine and delivering care for patients. Sometimes there will be things that is against your beliefs or your ethics, you or them or anyone. Then even not giving the care because it is contradict your ethics or your religion, will you need to deliver this refusal with the right context. Otherwise you will be under the law. So put this all in your mind. You're moving to the practice. They must do it freely and voluntarily. And I used to be in the National Guard, and at that time we had, and it has a very high load. You know that we had the best blood bank. You know why? We have campaigns and we have donors, and usually we encourage patients to donate, but also we used to have the new volunteers in the army. We ask them to donate. In the beginning, it used to be by order, and in the Navy, it's like in the medicine, we have to follow the hierarchy, or we give some benefits that they will be off of their days. So you used to come and donate, and we used to have the blood bank was one of the best. Going back now, no, this has changed. The leaders thought that this should always be with free will. We cannot just force them. So this is how we evolve and we think, and the kingdom is growing now and have a lot of changes. You will be part of the workforce, and you will be able to improve the practice, to fulfill the vision of 2030, to work and be an addition. Patient will sense that you are practicing with ethics. So always put it in your mind. Don't let the patient forced by time constraint, your anger. You give them only one chance, or this is your option, otherwise go look for something else. This is not ethical. You have to support the patient, whatever his decision is. Whatever his decision, if it is, this is not your decision, or to contradict your decision. You cannot force them. Doctor must also ensure that the information has been clearly understood, and we talked about this. So, according to Hacker and Moore, and I always repeat, Hacker and Moore is our reference. There is the prepared system. This is a general agreement that consent must be genuinely voluntary and made after adequate disclosure of information. So what are these preferred, referring to what? Which words? So it refers to plan, reason, expectation, references or preferences, alternatives, risks, expenses, and decision. So how questions will be coming to you. This is the question in exam and the question in life. It will come as a case scenario. Then you have to make sure that we fulfilled in our consent this. Any missing piece in our scenario, you have to be able to point it out and mention, is this adequate for consent or it's inadequate, and why it's inadequate. We always look for applying the knowledge, not memorizing the knowledge. How you apply the knowledge. This is the reason we are taking or studying medicine. So the plan is the course of action being considered. The reason, the indication or rationale why we are going for this options. The chances of benefit and failure, the culture, the references are culture and patient priorities. You cannot go and you just ignore their briefs. For instance, this patient wants an abortion for no medical reason, and it's not jeopardizing her life. In some states in the United States, not all states, you have to look at the law, they allow for abortion. You are Muslim. Abortion in Islam is not allowed unless it is going to harm the mother. It's fatal to the mother. So there is a committee in the thing. So what you will be do? You will deliver. You will tell her no, this is haram. No, you don't condemn. You don't judge. But this option, you have to tell her that there is an option. It doesn't go with my ethics or my religion, but I will be gladly referring you to someone who can help you with this. And you explain away from your beliefs and respecting their beliefs. You understand this? It's very important that it is not based on your belief, you force the care. But nobody can make you do or practice something that's against your beliefs. But you have to put it in the right context, because otherwise this is, if you say no, I don't care about you, I will not be helping you to do this is against, you have not delivered good care for your patients. Okay, so people still are coming. طيب صراحة المقاطعات هذه في الدخول. طيب, back to our, so we talk about alternative. Now we talk about risks, the potential harm from plans. What is the for different plans? What are the risks and expenses? What are the expenses? There is direct and indirect. You will say, we'll take this patient for a decision to do bilateral salpingectomy. She don't understand what is the risk. She will not be able to conceive in a regular way. She will need to go for IVF if she wants to get pregnant. So if you don't explain this, then she will be surprised, and maybe she don't have the cost, or she don't bear that cost, and she would have taken another decision. The last thing is the decision. Fully informed, collaborative choice. So we will take the choice together. It's not the choice of the doctor alone, and the patient cannot take the decision alone. It should be a joint decision. This is the preferred system. Clear? Any questions about this? It's very important for your practice, whether in OB-GYN or other branches. Okay. Right, we'll move on. So the exceptions to the rule of informed consent are any قاعدة, any system, there is some exceptions. So what is that? Patient brought into emergency and accident departments, unconscious, alone, and require life-saving measures. Do I wait till he's awake and he can take a decision? No, there is a system. So here, because he's unconscious and he's alone, nobody to consult, the legal ability to take the decision goes to the facility. في لها قانون. There is a law. So two consultant can take the decision. Another one, child under 16 years. In these cases, the parents may be given this right. Maybe. It depends. And remember, you have to know about the law. Impaired capacity to give consent. So you go to the guardian. واحد is not in his usual state. Unconscious, incompetent, mentally retarded, he's in a coma. So all this, you go for the guardian. Like confidentiality. One of the ethics or pillar of ethics is confidentiality. And this is how much confidentiality when we talk about it. So a doctor is expected to preserve absolute confidentiality in all that they know about their patient, not only during the treatment, but also after it and even after the patient's death. And this may include sometimes that you have confidentiality about the case from the partner, the husband or the wife. It's not always because they are married, they have the legal, or from sometimes the parents. They don't have the legal right to know everything. Sometimes the patient should be informed. And sometimes not everything that the patient will be having should be disclosed to officially. Sometimes the patient will ask this not to be reported. and this is the patient right, unless it breaks another law or another pillar, which is sometimes like communicable diseases. Some of them are listed that it must be listed to the authorities. So then you have to report it. You cannot say this is the patient decision. Right. This is an example. 30-year-old woman is diagnosed to have postpartum psychosis. You see, not blues, not, and she wants to kill the child, thinking that he's a monster. At this point, the physician's course of action is what we should do.
Protect the child.
Yes, and how we will protect the child?
نشوف another caregiver مثلا يقدر يقوم مهمة الأم.
Very good. So we look at the legal caregiver. The patient should go and refer to the psychiatrist, and she should get the proper treatment. Because if this patient goes home, the baby will not be safe, the family might not be safe. Psychosis means they have delusions and unreal beliefs. They might commit suicide or murder. Okay, so here we did not breach her confidentiality because she's in psychosis. She is not confident. Right. When a patient authorizes to do so in situations such as while seeking employment. So sometimes مو من حق أي أحد, he looks at your medical report or your medical health, even in the university. That's why when we send or you bring a sick leave, it should be based that we informed you and you agree that we are giving the medical report. In work, it's the same. You have to give the authority to your employer to get. And you as a practitioner, you cannot, somebody will tell you, give me a medical report about my student or about my employee. He doesn't have the right. He needs to have the official approval of the employee. The employer don't have this right alone. He should be having the approval of the responsible person or the person we are talking about him. Report prepared for a second opinion. This is one of the things. We have informed the patient that you want or he wants a second opinion. So you will be putting a report and he will share this report with his other physician or with authorities sometimes or committees that can help him. Healthcare team, of course, this is one we will be sharing the information in order to give the care. And this is given by default by the patient as he go and he sign to and agree to have the care in the hospital. Disclosure in the best interest of the patient. You don't put the things for sarcasm or for social. You disclose it in the best interest of the patient. يعني لأحسن فائدة للمريض. You have to be careful. ترى النوايا الكلمات محاسبين عليها وأنتم على أمانة عظيمة. Be careful how you talk and how you disclose your patient information. طيب. The public interest, and we mentioned the communicable disease. Holding back the information can cause harm to the member of the society. هذا برضو in the public interest. Legal requirement in the matter of laws on public health control of disease for research purposes, but only as anonymous data. Also for research, there is a consent that we will be using your information for research. Then, this is another example. 32-year-old woman with positive test for HIV antibodies refuses to notify her husband because of fear of end of marriage. The doctor best response would be what? يلا مشاركة please. This is a real case scenario.
لا لازم يكون على علم الطرف الآخر. إذا هو
You're breaching the confidentiality of the patient.
إذا كان هو أول شيء بقول له إنه ما في تطابق، ما راح أعلم بالسبب. بس إذا أصروا لازم يكون عارف الطرف الآخر ولا؟ يعني
نسمع من البقية. يلا تعالى.
هذا أحس مختلف لأنه في ضرر على الطرف الآخر. سوري بالغلط جاوبت، آسفة.
أوكي. لا أنا قلت تعالى.
Yes. So we counseling and encourage the patient to inform their spouse and explain the serious risk to them, and also offer support for disclosures. And so we counseling sessions.
Good. Okay, so this is an option. So زميلتكم تارة تقول إحنا هنعمل counseling and encourage the patient to inform about her family member, okay, or her partner or her husband. Remember that you might be practicing in non-Muslim countries. You should be non-judgmental in your discussion. Okay. في أحد تاني كان بيجاوب؟ نوف تفضلي.
أعتقد لما يصير في ضرر على الطرف الآخر يختلف القوانين. اللي أعرفه مثلا زي HIV, this will affect the husband also, he will get the disease. فأعتقد إنه يصير فيه معاهم زي أحد من الأخصائي الاجتماعي، وهو it's a must to inform the husband because he will get affected also. فحتى if she refused بيصير في طريقة معينة لأن هذا في ضرر على الطرف الآخر.
تمام. أوكي. So زميلتكم تقول إحنا لازم لأنه هذا يتعارض مع مصلحة الطرف الآخر ويؤثر عليه وأنا لازم أشرح له. أوكي. و I think هاجر give a thumbs up لنوف. في أي رأي ثاني ولا نعمل ده شو اسمه we conclude about the case. وهج.
دكتور أنا أشوف مبدئيا إن إحنا encourage the patient بالبداية إنها نحاول نقنعها يعني تقول للطرف الثاني، لكن إذا أصرت على الرفض خلاص يصير لازم إحنا نبلغ البيشنت الطرف الثاني.
But if she doesn't go and willingly give, we will enforce the benefits of or the risk on the other partner and will protect them. طيب, thank you. عشان time. This is a real scenario. It comes in questions and you can face in the clinic. May God forbid. It's a very difficult disclosure of a disease and how you will work on it and refer. But the law say this husband or this partner, they are already, it is a communicable disease or sexual transmitted disease. So they are already together, and not now is the case where he will be affected. He's already affected because they are practicing. They are married together. But you should be informing the authorities because the law say that you need to report it. This is a law. Other than other. يعني لو كان ده chlamydia, gonorrhea, you don't, gonorrhea no, you need, chlamydia no. So it depends on the disease and you will be taking the disease in different specialty and in OB-GYN and you have to know what is the law and the law change by the place, by the time. You have always to be knowing the law. In this case, you need to report it. You encourage her to inform the husband and you have to refer her. And there is a special team in the ministry who take care of these cases and they work on the treatment and even they involve them and protect them to work with dignity and confidentiality. So you cannot go and breach the confidentiality. Practice and the transmission already happened or is happening. So it's not our choice now to discuss. And this is the right way how to answer it if it comes to in the question of the Saudi or the USMD, the SMD or USMD. Okay, so we'll be moving on. The modern principle of data protection. طبعا a very important part of confidentiality is now the data and everything now it used to be in paper and the files will be in the nurse station or in the storage. Now, where is the data? It's in the HIS system, right? In the health information system. So the accessibility to the cases in the first health information system was developed. Everybody, any healthcare provider, he can go in. And we used to leave the files open of the patient and also it was a shared password. Everyone can read anything about anybody, anytime. Now, no, we have data protection law and no accessibility to the data should be justified and only for the healthcare provider who is involved in the patient care. Not anyone in the hospital can go and see and read the data. Also, it should be stored in the way that will be in the best interest of the patient. Not everybody, and you don't label this is an HIV patient. Everybody will see, even he doesn't know and go inside, this is an HIV. Oh, in the ward, oh, this is the patient who is diseased with gonorrhea. No, it doesn't work like this. You have to apply the principles of ethics in the data protection. And you can read this. So, next, justice, beneficence, and non-beneficence. So justice is based for race, sex, religion, and these are not considered morally legitimate criteria for the distribution of benefits. And you cannot say that based on race, I will give this benefit for people. Based on the gender, I will give this benefit for males or female, or the religion. It should be on other criteria. So when the resources are scarce, issues proper and clear distribution of care should follow clear guidelines that are fair for everybody and free of bias. So how we apply this? أنا أقول لكم triage in the ER, and I will talk to you about VIP rooms in the hospitals, in governmental hospital. That is the right for everybody. Now, if somebody comes in the system and one is VIP but he have flu, and the other one is bleeding and he's just a regular person, who should take the care first? Of course, the one based on his medical situation. That if anyone in the same medical situation, he will get the same clear, and he will get the least, or not the least, the optimum health care, not based on health. But in the rooms, you have admission. One VIP room and the other is a normal room. This is based on the hierarchy is acceptable. But you cannot give this to your relative or somebody you know, and you don't give it to another based on your relationship. This is not right. There will be a system. This level, they should take this type of room. On the contrary, you have one single room, and some hospitals have 2-bed or 4-bed rooms. The patient has, one is IFD, and she's even non-eligible, but she came to the hospital and you give care. The other one is a doctor who had a normal delivery. By definition or by the guidelines and the law, the consultant, he takes a single room. The non-eligible, she will be in the common room, 2-bed or 4-bed, صح? But she had an IFD. Is it right I put her with pregnant ladies? Because she will be admitted to the Ubegani ward. Is this ethical? She carrying a dead baby, and the other have alive babies, and they're expecting for a happy outcome. So now, even this is the right of the consultant who has delivered. No, it will go for that non-eligible patient, because this is the right decision based on her health and medical situation. Be very careful. Some of you will be hospital administrators. You have to enforce ethical practice. طيب. Also هنا beneficence. Be nice, be better and kind. And I always say, if you are going to give just the care, you are not giving the optimum care. لازم يكون في إحسان. المبدأ عندنا is beneficence. إحسان. الإحسان ما هو الإحسان؟ نعطي حقه الإنسان حقه، كل واحد يأخذ حقه؟ لا. إحسان, you give it with and more. You give it with empathy, with care, with smiling. You're happy. So please think about your practice. We are in مسؤولية كبيرة والأمانة كبيرة. لا تحمل نفسك أوزار أنت لست بحمل لها. طيب. Non-maleficence هو طبعا do no harm. هذا القاعدة الأولى في الطب. Do no harm. So it originated from the Hippocratic school, and although few would dispute the basic concept, in day-to-day medical practice, physicians and their patients may need to accept some harm from treatment. زي لما نعمل we have to do an incision to do the surgery, so there is some harm. So in concept, but in general, is we're doing good for the patient, as amputation for an infected leg, and etc. Like how ethics interact with clinical decision is very important, and this is how we changed in our shared decision and clinical reasoning. So appraise of the principle of ethics. Before, you can see on the left the clinical reasoning or the problem, then history, exam data, right? اللي هم doing labs and everything. Differential diagnosis, clinical assessment, further diagnostic evaluation, and then the treatment plan. This is what we used to study before. But this is not the right way how to deliver care, because you did not involve, this is not a patient-centric care. And now we are talking about student experience. Student should be in the middle of the, because he's the customer, he's the benefit, he's my graduate, also in hospital. Who is taking the care is the patient. So when we talk about decision, it should be including the patient goals and background and ethics. So we go from clinical reasoning, the problem, medical facts, medical goals, patient goals, and the context, his beliefs and culture, and the situation that we are practicing in. Sometimes we are in a secondary hospital. We don't have the facility of the tertiary hospital. So this is the context. His belief is different. This is the context. Patient goals, what he wants to fulfill, not what I want to fulfill. Then differential diagnosis and ethical assessment, then further information diagnostic, then the best course of action. Not just a treatment plan, the best course of action. And the decision could be different for the same case from one person to another, based on all what we talked about. Clear? Is this clear?
Yes, that's clear, doctor.
Yes.
Okay.
Yes.
So, how we appraise the principles of ethics? We have rationing, and we have implicit and explicit. So implicit, based on access or ability to pay, and this is irrational decision. You will be practicing in private. So payment is one major factor. Right? Payment is there because nothing can run for free. But if it will be jeopardizing the patient's health in an emergency, and there is no other alternative by law in the Saudi Arabia, if somebody comes in emergency to any hospital, they cannot refuse them. Emergency that is threatening their life or major limb loss. Not any emergency, كل الحياة emergencies, but you have to differentiate what emergency. What is the explicit or the plan? It is based on measured values, and this is to be a rationale. So here in the emergency, this is the based on the measured value. The value is to saving lives. So anything else, we will be working it out. Okay. Remember that the interface of medicine and the law raises major ethical issues because legality and morality are not always synonymous. And this doesn't mean that I will break the law. But as a healthcare provider, there is the right way how to improve the law or improve the guidelines for the patient interest. But we don't go and break the law. But if you realize that there is some issue with some law or guidelines, go and work on it in the right way to fix it. But please don't break the law. Like, if you are not sure in any situation, you can always consult the ethical committee in the hospital or a higher authority. Sometimes you don't have this ethical committee in hospital. But if you are in the leader in the hospital, or you have a decision, or you are part of the hospital, make a suggestion to form this ethical committee. It's very important to take decision through committees and the ethical committee. What is in the best interest of your patient and her wishes or goals, and keep her informed. Always keep your patient about the new things. Like, these are ethical dilemmas, and I will not go on it by ourselves. You can read it. You have any issues, you can talk and discuss it. This is like case discussion and homeworks. You can work on it and discuss it. Whatever you don't understand or you cannot have it, I would encourage that you work on it in groups and you discuss it and take the outcomes of them. طيب. Drugs in pregnancy and lactation, always look at minimizing these medication, use alternatives, or sometimes if there is no alternative, you have to give an alternative for the patient at the baby care, and we should be an advocate for breastfeeding. طيب. IVF is a big issue, and I just want to inform, you can read the cases and the information, but one thing, IVF ايش الحكم فيه الآن؟ هو مباح يجوز صح؟ أي أحد يختلف أو أحد عنده اختلاف؟ أوكي، هو مباح وهو جائز، لكن الآن في ناس يعملوه عشان ضرورة صح؟ عندهم عقم ويحتاجوا يعملوه، في ناس يعملوه for gender selection. Outside they can even choose the color of the eyes and the hair and this. طيب سمعتوا or did you hear about cases where there were mixing of the samples? I think recently in the social media there was a case, there was mixing of the babies. So there is a risk of اختلاط أنساب بالغلط، أحيانا في مجرمين or في criminals في psychos. It's very very risky, and I always, if you want to take a decision, look at the consequences. If you can bear the consequences, then you can do it. If you cannot bear the consequences, think million times about the decision you are taking. So let us put a scenario and think about it. And I'm not saying it is haram or halal, but I always think about the decision. Okay? It is now mubah wa jaiz. لكن somebody who do an IVF for gender selection. Now all the offspring that came from the lab came as males, and he want a female, he want a girl. You know what they will do with the samples, with the embryos? Does anyone know?
No.
They will discard it. They will throw it in the garbage. Is this ethical? هذه نعمة ربنا.
No.
Okay. Some of them, they get very surprised when you tell them what will happen. This is the informed consent. They will say, no, doctor, I will not do this. هذا كفر نعمة. In his opinion, أنا ما بتكلم عني، بس أخلاقياته تختلف من إنسان لإنسان، مبادئ وهالأشياء. بعض يقول لك okay, I'm happy. الدين إيش يقول؟ الدين قالوا حلال، خلاص أو جائز، I will do it. طيب. Another scenario I always talk about. صار في mixing، انت رايح عشان تختار gender selection، طلع ال other gender، صار mistake، في mosaicisms، any whatever. What you will do? You will terminate. صار الحمل. You cannot terminate. Abortion is not there. صار شيء ثاني، انخلطت الأنساب، sample بالغلط جات، صار عندك طفل ما هو related to you. دخلنا في أخلاقيات، دخلنا في عوائل، في أنساب، في هالأشياء، صح؟ So it's very, very health and practice and treatment. They have other aspects, not just what you are seeing or the first impression. It has roots of other issues that can rise or consequences that can happen. Think about it and let it discuss it. It's very enriching and enlightening to your ability, how you will be practicing and how you take decisions and how you counsel your patients. And I talk to you now as practitioners. I'm not talking to you as students. In the last we will be talking about the clinicians should be encouraged to refuse to initiate any treatment option they regarded as having very poor prognosis, provided they are fully informed the patient and the information about referrals if appropriate. وهذا تكلمنا عليها. إذا واحد يبي يعمل termination of pregnancy and you is against your religion or ethics, you have to refer them. Somebody wants a procedure that is doesn't have a good outcome, you have the right to refuse. but you don't enforce it to the patient. You can refer, if she really wants it or he wants it, you can refer them to somebody who believes he can have a better prognosis or is convinced. But after you're giving the full information for the patient, you should not deny them the care, but you have give them alternatives. With you, alternative people to care for them. There is nothing that will be insulting to you that somebody else will give them the care. Ensuring high success rate by not treating patients with poor prognosis should be regarded as unethical. So, selecting which cases, in IVF especially, sometimes they will choose the one with the very high positive outcome. The one with the expected least or poorer prognosis, they will not treat. This is not ethical. الشفاء من عندنا ومن عند ربنا. احنا اسباب ولسنا احنا فعلا الشافيين. الشافي هو الله. So you have to be, but if there is scarce in the resources, you will give for the best outcome, but based on a guideline, not based on your opinion. This is different. When there is a guideline, it's different from your opinion and your abilities. Sometimes you have a poor prognosis with you in this procedure, but they have a better prognosis with others. So you refer them. There is increased litigation following the adverse outcome of multiple pregnancy. طبعا before we used to return 4 or 5 babies, and then we have quadruplets, 5 or even 3 with a very high risk, and the delivery will be very preterm, and the outcome, and some will have congenital anomalies. Now, in some areas or some countries, the law is to return 2 or 1. More than that is considered malpractice. However, always remember your religion, your ethics, how you are practicing, and are you giving good care, and look at the law and abide by the law. If you see something in the law is against the patient's will, don't break the law, but work on changing that law in the right way and the right matter, in the right context. Thank you. Any questions?
واضح الله
Okay,
دكتور.
doctor.
يلا يعطيكم العافية. إذا عندكم أي أسئلة you can send me on email for questions or discussions. Thank you.
تمام واضح، يعطيك العافية دكتور.